Let me begin by saying that the risk of exposure in Alberta is still considered low. There are no probable or confirmed cases of the novel coronavirus in the province. Canada has still only confirmed a small number of cases, and the system has quickly responded. This shows the public health measures put in place are working. In recent days, we have seen an increase in cases being reported in a number of countries outside of China. I know many Albertans may have questions about what this means for them and what we are doing to protect their health. The fact is, the global situation is changing rapidly. Although China continues to have the highest number of cases, the spread of this virus to new countries is concerning. We do not know what direction the outbreak will take next, but we do know that we need to be prepared for a scenario where COVID-19 continues to spread in countries around the world. Alberta continues to closely monitor the situation outside our province and is in daily contact with our national partners. Based on this evolving information, we are joining the rest of Canada in taking additional precautions to limit risk and protect the health of Albertans. Going forward, we are expanding our testing protocol to include the following areas in addition to China: Hong Kong, Singapore, Iran, South Korea, Japan, and Italy. We ask any travelers returning from these areas, in addition to those returning from mainland China, to monitor their symptoms for 14 days after returning. Should these individuals experience symptoms like fever or cough, or have any concerns about their health, I encourage them to stay home and call HealthLink at 811 to see if there is a need for testing or follow-up. I want to be clear, travelers from these areas are not required to self-isolate at this time unless they have returned from China's Hubei province. We are following the same approach being adopted across Canada, focusing on those countries where current information indicates that there is a risk of being exposed to the virus that causes COVID-19 in the community. As we prepare for the possibility that this virus could come to Alberta, I urge you to practice the good infection prevention habits that are always recommended. First, protect others by staying home when you're sick and covering coughs and sneezes. Second, protect yourself by regularly washing your hands, avoiding touching your face with unwashed hands, and staying 1 meter away from others who are coughing and sneezing. As we make these preparations, I want to reiterate that the current risk in Alberta remains low. There are still no cases of the novel coronavirus in Alberta, and we are prepared if that should change. We will continue to provide frequent updates as the situation evolves. I encourage you to visit alberta.ca/coronavirus for the latest up-to-date information.